Welcome to the module Advocacy and Public Health. I'm Dr. Donna Gruley. I have to be honest, I spoke with other public health and healthcare professionals as I was developing this module on advocacy. And when I asked them about advocacy, I either got a blank stare or the question, "What do you think advocacy is?" from most of these people. Advocacy means many things to different people, depending on their background, the problem or issue, and the context in which they view it. So let me give you a simple definition of advocacy. It means that you are working on behalf of others to make a hopefully positive change. Some examples of advocacy include signing a petition urging elected officials to vote for a specific healthcare policy, hosting a town hall meeting to hear the community's concerns about an environmental issue, or convening a group of local nonprofit and community leaders on bringing more jobs to the area. From these examples, you can see that advocacy takes on the form of many different types of action, all with the goal of improving a condition that impacts people. In the reading materials, the term constituency is often used. A constituency is a group of people that support or are served by an organization. It's also a group of people that benefit from an organization's actions. Examples of a constituency include community members who are served by a local public health department, or a patient population who benefit from a hospital's community outreach program. Engagement incorporates both the art and science of establishing and building relationships between a constituency and an organization. Engaging constituencies happens through 4 practice-related elements. The first is knowing the community and one or more groups of the constituencies. Second is establishing strategies that guide or direct the interactions with constituencies. Third, building networks to communicate, leverage resources, and ultimately sustain the relationship. And finally, mobilizing the constituency to make decisions and take action. Remember these 4 elements: know, establish, build, and mobilize. To further define engaging communities, the text outlines 5 levels of participation and leadership between an organization and its constituency. The first level is outreach, which simply establishes one-way communication. These channels of communication will disseminate knowledge but do not seek input from the constituency. The second level is consult. On this next level of participation, information starts to flow back to the organization from the community. This action starts to develop connections between the two. The third level is involve. Communication is still flowing in both directions. The difference is that it involves cooperation. This is the beginning of a partnership. Building on the partnership involves collaboration, the 4th level, which includes building trust through direct community involvement. And finally, a shared leadership level means that the community now becomes involved in co-developing information, communication, and suggests solutions to issues. This shared sense of involvement strengthens and deepens the partnership and leads to increased trust. When you've reached this level of trust and communication, transformation within the community starts to happen. Let's say, for example, that a health department conducts community meetings to give information on causes of obesity and diabetes. Information is given to each participant who attends. Which level of engagement would this represent? Since the health department is not asking for communication back from the community, but instead pushing information to them, this would be outreach, right? But if the health department now asks for feedback from the community on the event or seeks more information, this level of participation would probably be consult, depending on the level of involvement on the community's part. Here are 4 strategies that organizations use for interaction with constituents. In other words, these strategies describe how the organization takes action. The previous list describes steps and levels of how an organization can engage its constituency. So first is authoritative, and this involves policy and enforcement. This interaction means that the organization has authoritative control over the constituents. An example would be a local city council that enacts a no smoking in public policy, which local law enforcement enforces within the community. That's authoritative. Next is competitive, and that's a strategy that makes the option more attractive than other options. This is often used when public funding is sought, such as street improvements through the implementation of a local tax. The tax would distribute the cost of implementation over time rather than strapping the municipality with the immediate cost of the entire project. Cooperation establishes an agreement between the constituents and the organization. 3 types of cooperative strategies are listed here. The Healthy People 2020 goals are an example of cooperation at many levels because all are working towards these common agreed upon objectives. And finally, disruption strategies threaten the capacity of an adversary by generating resources and growing its capacity. Finally, disruption are strategies that threaten the capacity of an adversary of generating resources and growing its capacity. A big success of this strategy has been the multiple anti-tobacco campaigns at the state and national levels to disrupt tobacco companies from marketing to minors. These strategies employ different elements for interaction. Depending on the situation, the best strategy selected would have a positive outcome. Let's say, for example, that you have an organization, Frito-Lay, that is legally selling a product, snack foods, that harms the public by creating excess calories, weight gain, and related diseases. So what strategy would you use to interact on behalf of your constituency? Would you enact a policy that creates a tax on snack foods and uses the money for prevention initiatives? Would you establish a contract that snack foods must meet certain nutrition criteria, such as a certain number of grams of sodium, fat, and calories per serving? Or would you target the sales of snack foods by creating a cheaper, healthier snack food, such as a seasonal fruit? Your options are driven by your goals, the target community, and your constituency. If you're going to tax snack foods, but you're in the middle of a food desert, how would this help poor people who don't have access to affordable, healthy foods? A number of tools have been developed by regional and national community-based organizations to mobilize and evaluate community interactions and interventions. The text somewhat describes these individual tools. However, what I'd like to point out is that you need to have an understanding of the constituency's needs and how you can best implement the necessary action. This should involve the constituents to best determine their health priorities and help to empower them to meet these needs. A classic example of not meeting the constituency's needs was a regional air quality organization in Southern California that wanted to improve air quality and asthma attacks in children. However, when the community was finally invited to participate in the discussions, it was discovered that air quality was the lowest item on their list of priorities. Their top priority was community safety so that their kids could walk to school and not be harassed or attacked by local gang members. Talk about a big miss in understanding the community. Another example was a community in Southern California whose constituents had great concerns about a chemical previously used by a former Air Force base that was contaminating the drinking water. When the EPA came to host a town hall meeting, what they communicated was the exact opposite. They all showed up with bottled water. How much value would you put in an organization that said one thing and demonstrated the opposite? The materials covered in this presentation are intended to help you to advocate for communities by engaging the constituents within your sphere of influence and understanding their needs. By understanding the process of engagement, your advocacy efforts will be much more successful. Thanks for watching.